We are getting ready to broadcast live. Deuk laser disc repair for a thoracic disc herniation, T10-11 on the right side. This patient's had extensive back surgery, many of them including fusion. From L2 to S1, she has a spinal cord stimulator. But we're going to go repair one disc, the right T10-11. She has a CAT scan that shows a herniation there. She's having pain exactly in that spot. All right, let's get started. So I'm looking at my x-ray and we see the screws at at L2. That means the one above is L1 and then T12. Yeah, and that T12 has a short rib, very short ribs. 12, 11, 10. So Luis, you had it and that's there. All right, I'm going to give you a little numbing medicine, okay? A little numbing medicine. Just, it's a little stick and burn. A little stick and burn. Sorry about that. That's just the numbing medicine going in. I apologize. I put in 2 cc's. Well, hold on now. Take that. All right, so let's get a shot. 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 There's definitely some scoliosis. So 1, 12, 11, 10. Pedicle of 10 on her right. So we want to be a little below that. Yeah, that's good. All right. You okay? No. You don't have to take a shot. Let me just think. Now, when you're doing thoracic, you always have to worry about the lung fields. And I'm checking her out, her hips. So about 4 or 5 here. And then 3, 2, 1, 12, 11. It's perfect. Blood pressure is good. Maybe we can get it down just a little bit. Unless you want me to wait, but it'd be good if we can get it down just a little bit. And you really need to be able to visualize the spine and everything around it. Shot. Okay. Shot. Let's go lateral. So I've chosen an entry point that's a few inches off the midline. There's no way you can judge the entry point for your needle based on skin and midline. You really have, because people's spines are twisted, so you have to take that into account. All right, 2, 1, 12, 11, 10. What's that? 2, 1, 12, 11, 10, 9. Yeah, that's better. So I need to be a little bit lower, I think. So that's 1, 12, 11, 10. 10, 11 is where we're going. Everyone agree? I think that's pretty good, Jordan, there. But I need to be lower. So I've already injected lower. I'm going to make my entry point a little bit lower. Shot. Are you comfy? 1, 12, 11, 10. Shot. Shot. It's lining up nicely. Shot. Let's get an AP. So it's 1, 12, 11, 10. I'm always counting, by the way, for those of you watching, because I want to make sure you can take your eyes away, you can move the fluoro just an inch, and it changes everything. That looks good. So you always have to recount. Every time you change anything, you want to recount. Let me know when you get it down. The pressure. Yeah, I'm ready for the shot. All right, so we're going to encounter the facet joints in a moment, and we are medial to the lung field, but we still have to be paying attention to it because we're still in the area of the lung field, so it's important. All right, I want to hit the facet, and there it is, and then I want to wrap around it. A little too low. Yeah, I think we're off on orbit maybe. Do you see that?
Yes, sir.
If we could fix it a little bit, that's good. And a little south shot. Where do you feel that? In your back, right? You let me know, Sean, if you get any short of breath, okay? All right, so we're pretty close on the view 1, 12, 11, 10. Let's go AP. We're right around the facet of T11, T10-11, but more on the facet of T11. Perfect. Back to a lateral.
She's a 111 assistant.
Thanks. So basically, 12, 11, 10. Shot. Shot. You all right? Shot. 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 All right, so we're right there. There's 1, 12, 11, 10. Give me an AP, please. So we're right at the entrance to the disc. Looks really good on there, looks really good on there. So perfect, we're right at the, almost at the mid-pedicular line. I'm very happy. How's our video recording going, or broadcast?
Pretty good, sir.
Shot? All right, because the disc is so collapsed, I might have to just plant my guide wire, and we're gonna have to put her to sleep and try to enter the disc at that point. Okay? I think that's as close as I'm gonna get. I think with her being asleep, we can, she'll be more relaxed and I'll be able to get in. But that's really, really good. Huh? Oh, it's totally collapsed. Very, very bad degenerative disc disease. All right, so we're not going to be able to do our discogram. Are you okay? Are you in any pain? No? Huh? Is that where you typically get your pain? So we're in the right area, right? All right. We're going to put you to sleep, okay? Count from 1 to 100 out loud. Keep going. Shot. Keep going. You're doing really good. Yeah, whatever you want to do. That's right. It lowers the seizure threshold. But we're not doing a discogram. Right? Keep going. Let me give her a little more local. You're doing really good.
And we don't have any more fentanyl.
What?
No more fentanyl. It's on back order, so it's kind of dealing with those challenges here in this case. There's no fentanyl.
You're gonna do propofol though, right?
Oh yeah, oh yeah. Should get going.
I'm gonna give you some more numbing
It's
medicine.
not a lot of analgesia, so I appreciate the numbing medicine.
I didn't know we have no fentanyl.
I'm doing my best over here.
What?
Working with what I got. Very flexible guy.
Oh, it's coming tomorrow? I guess there's a national back order on fentanyl, so we have.
He used to have a lot of it in the last case. That was kind of hard. That's challenging. Yeah. I want that one. Okay, that's good. It's time that. It's time
You gotta, yeah, keep an eye on that situation. Who does the ordering? You know what I mean?
Okay. It's just hard. It's on back order, national back order.
Well,
Gotta stay on top.
that's what they say, but is it true?
We gotta order a lot of it. So in case this happens again, in case it happens again. Yeah. We had the same problem in Vegas.
Yeah, but the thing is, you do. But the thing is, we're in Florida. They like us better here.
Hey, good.
Yeah. No, but in all reality, it may be on back order with McKesson, but it may not be on back order with another supplier like Henry Schein. So we got to make sure they're calling. All right.
She seems to be really on it.
All right. I appreciate that. So, folks, so far, if you look at the x-ray that we took a little while ago, you can see that we're at the back of the disc. It is the T10-11 disc. We're on the right side, and I was unable to access the disc because the patient is I'm gonna try to go in with her asleep because the patient's awake, and whenever people feel a little bit of pain in an area, they'll kind of tighten up in that area, and that's just the muscles contracting. So I was kind of thinking maybe we can put her to sleep and I'll be able to get in a little easier. But sometimes if we're not, what I'll do is I'll put my patient to sleep and then I can get into it with the dilator. So right now I'm trying the needle, and again, I'm right there at the back of the disc. So here we go. We'll just take this guide wire. I've already made my incision. The guide wire is now anchored at the back of that disc. And everyone agrees that is 10-11, right? So I'm going to leave my guide wire there. Bring my needle back, shot. There's your guide wire right there. Okay. Patient's doing good. She's asleep. And I'm just going to take my time. I'm just medial to the lung field, posteromedial, shot. And we're lateral to the spinal cord, shot. Shot. So I'm coming in transforaminal to the thoracic. Shot. And I've got to get this thing all the way down to the back of the disc. I can feel the osteophytes. Shot. She comfy? I'm not seeing any signs of issues here. All right. Now, do you have something that can help me, Luis? Tap over that guide wire. Yep. Mm-hmm. Yeah, you're fine. So she's sleeping.
Well, I can hold the guy wire and shot it if you want.
No. Shot. Let's just get a quick AP. I want to just check positioning. That's perfect. We know we're at the right level, and we're just at the back of that disc. It's so collapsed, so arthritic, but I believe this is where her pain's coming from. So the CAT scan confirmed that. She doesn't have an MRI because she has a stimulator. But you can see we're right at the back of that disc there. Huh? No, no. Shot. That looks good. She okay? She all right? Shot. All right. Shot. 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 Yeah, let's take the pipe cleaner. So we're inside the disc now at T, so it's L1, 12, 11, 10. Yeah. So we're going to need to clean the end out. Shot? Perfect. Now, dye. I want to do a discogram. It'd be nice to verify that I'm inside the disc with a discogram. Yeah, you need a 22. Sean, give me a 22.
Can I have 22, please?
Yeah, you always need a 22.
Yep. Hey, like for the second level on the cervical, please. Yeah.
Oh, like the.
Oh, you want a normal?
Yeah, okay.
All right.
Can we use like a normal 22?
Whatever the, no, I want a long one.
Yeah.
Look at the air bubbling out. That's pretty amazing. You know what that is? That's, yeah, that's, you know, have you ever heard of vacuum space phenomena where there's air inside the disk space? That's it. It's when you have a really degenerated disc. All right, hold on. Let me just clean it up a little. No. You know how many discitises I've seen in my career? So few. Hey, wait. Where's the little rubber cap at the top? Remember that thing? We could try to do it without it. Just go find it, though.
No,
Oh,
I got it here.
I got it.
I have it in my other too, yeah.
You-
It's good.
I'm going to try. Shot? I think we got some. There it is. So we're inside the disc. We're good, guys. We don't need it. You can see the discogram that shows we're inside the disc. You got to do that because you never know, you might be in the bone, and then you do a vertebrogram. Yeah, we do that. Oh, you mean to bang it? It'll go right through the rubber. All right, so at this point, we've accessed the disc transforaminal, and now we're going to place this tube, and we're going to do the entire surgery through this 4mm tube. By the way, why don't you show our audience why disc herniations cause back pain and thoracic pain? Can you do a video animation for me,
Yes, sir.
Kevin? Thank you.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Now we need to get her a little deeper. Shot. So at this point, we have introduced the dilator followed by the tube. This is called a tubular retractor. We're going to do the whole surgery through that tube. So I have to advance the tube down into the disc, transforaminal. Let me know when she's ready to go, because I need her relaxed. Let's get a quick AP shot just to show our viewers. Doc, let me know when she's deep enough. Perfect. All right, will you show our viewers how the laser surgery works? Can you show them the video, please?
Yes, sir.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.
All right, well, while you guys were off watching movies, we were working hard in the operating room. So we've taken the dilator out and we're left with the tube, which I'll show you. Can you see this? Pretty good right here.
Yes, sir.
And we're going to do the whole surgery through this here tube. Just lay still. All right. Now to do the surgery, we use our endoscopic rig. Is that you or her? The endoscopic rig's got the endoscope with a light attachment. It has irrigation. And we have a laser. We thought about using dolphins with laser beams attached to their head. Sharks. And then we have our camera here. By the way, I'm giving a talk in Los Angeles at a prestigious neuroscience conference coming up in the next few months. And I'll be talking about this surgery. So, all right, little pieces of herniation there coming out. How are we doing, boss? Are we good? Can I proceed? Yes. All right, you can see the laser. That's the glass laser fiber. I need the pedal by my feet. I can't look for it. I got something here. This wire should not be there. It's supposed to be a flat floor. All right.
Lights off, please.
Thank you.
Thank you.
There's some herniated disc right there. You see the blue stuff? That's a common site with the Deuk laser disc repair. There's a piece of herniation right there. So the reason why the herniated fragments, they're really made up of something called nucleus pulposus. And the nucleus pulposus is this jelly that's located in the middle of the disc. The nucleus pulposus, it's a good one, is like a hydraulic cushion between the bones. And you're born with the right amount, and as we get older, it starts to disintegrate. Not from age, but from injury to the disc. As a matter of fact, if you don't have any disc injury, there'll be normal nucleus pulposus in your spine until the day you die. But with injury like trauma, car accidents, sports injuries, what happens is this nucleus pulposus seeps out through a tear in the back of the disc called an annular tear. And the annular tear is a result of trauma, lifetime trauma. So football injury, cheerleading injury, gymnastics, you name it. There's lots of reasons, but that's exactly what happens. And when people get that tear, it's called an annular tear, the jelly can then push through the tear and cause inflammation within the tear. That's where the back pain comes from. You already showed the back pain video?
Yes, sir.
And you've shown the Deuk laser disc repair animation video, right?
Yes, sir.
Perfect. Now, the first time we did this type of surgery in the thoracic spine for a thoracic herniated disc was 2 years ago. And the patient did so well, we decided we had to do more of these types of surgery. There's a herniation right there. So we had more patients come that had thoracic pain. They had an MRI scan that showed a herniated disc. We call it a thoracic disc herniation. And we realized that thoracic disc herniations were a common cause of pain in the thoracic area, and that we could actually treat them with this surgery and get rid of their patient's pain. But you have to treat all the herniated discs. You can't just treat one. And so we recognize that most people have more than one as the source of their pain. So this is a piece of herniation here that I'm working on with a laser. I'm trying to break it up. I may be able to get it with the grabber later. So I'm going to keep working on this tear. It is, yeah. It's collagenized and calcified. You're right. I have done maybe 14. This is our 14th or 15th. I'm not sure exact number. You might know better than me, as a matter of fact. Right? I'm sure it's in our computer system. We are very interested in reporting the results of this thoracic surgery, thoracic spine surgery.
It might be like 10 even.
10? No, it's more than 10. I'm,
Someone between 10 and 15.
yeah.
They've all been since I've been here.
They've all been in the last 2 years. Is she okay? Huh?
Yeah. Okay, sweetheart.
Look at that piece there. I need to try to grab that out. You need help?
Debbie, you're doing great.
Any questions from our audience?
No, sir.
I think I got a piece there. Now these thoracic disc herniations are not big. They're a bit underwhelming in terms of the size. If you look at the MRI, you might not be that impressed. But boy, can they be painful. Ask anybody with a thoracic disc herniation. See if I can grab that one. These are a bugger to grab because they're so hard. They're like rocks. No. And I'm in the process of trying to make them smaller and easier to get out by using the laser on them. But for sure, there we go. You're doing great. Just relax. Take a deep breath. You're fine. So the risks of thoracic endoscopic surgery are even more challenging, I think, than cervical or lumbar. It's like fighting a little, almost small enough to get rid of, right? Come on now. Ask for a what? IV? Here it comes. Finally, we won. Persistence pays off. All right. How is she doing?
She's relaxing more now. She's breathing really well.
Good.
What I can see.
Pretty cool, huh? Going inside a thoracic disc. So it's a real treat. You won't find this surgery done anywhere else in the world. We developed this here at Deuk Spine Institute. It's called the Deuk Laser Disc Repair. You're doing great. We're getting all those herniations out. See if I can grab it out. I probably need 10 minutes. So, any questions from our audience? Kevin?
No, sir.
Why don't we run a testimonial of one of the patients who had this thoracic Deuk laser disc repair so people can see the kind of results that we can get. Turn.
That young guy, he was
Oh yeah, the young guy.
wasn't his like high up like 5'6" or something crazy?
Yeah, he was like a T6-7, I think. You're right.
Yeah. And he could have that huge surgery that was
Uh-huh. He was in pain for years.
he was young, like 19.
Yeah. We did surgery on a young man who ended up going to Australia, as a matter of fact. He was a therapist. He didn't want fusion. He didn't want it at all. He knew about fusion and just didn't want to have one done. Found out about our procedure and came out from California. Spent a couple of days here, about 3 days, and then went to Australia right afterwards. So you can see the end plates of the vertebral bodies left and right, and can actually see there's not much of this disc left. So we're not doing this surgery because of the amount of disc that's left. We're doing it because we want to get rid of her pain that's coming from this disc. And I'm convinced this disc is the source of her pain. So that's why we're doing this particular surgery. You can see the laser just melts the old herniation away. And do we get some more of the side firing lasers?
Yes, we have to.
Good. Good. Almost done. Another 5 minutes or so. It's just so hard to get these pieces out. They're really too big, and I'm trying to break them down with the laser into smaller pieces. So really at 12 o'clock is medial. Those are all fragments of herniation. And at 6 o'clock is lateral. And I want to go back and forth as I'm working on this annular tear, because some of that tear and herniation will be behind me and some of it will be at the 12 o'clock position. And this part over here is lateral, and then the medial part is medial. The 12 o'clock part is medial. Almost done. Right here should be the last of it. This is going to be the more painful part. Yeah, this is the inflamed part of the tear that's causing her pain. And she's tensing up a little bit. So, just about done. Just about done. 2 more minutes. Any questions from our audience, Kevin? No?
One question from Clarence from Facebook.
Sure.
What's the estimated cost for this laser surgery?
The laser surgery cost depends on how many discs you're having done. More discs mean more cost. So it depends on how many discs generally are being done. But estimated, it's around 20,000 US dollars.
Joe just informing that this is your 15th thoracic surgery.
15th. All right, so we've done 15. This is number 15. So it's not a lot of numbers, and it's kind of exciting because it's a new technology. No one in the world has ever done it. We're the first. So being the first, we get to do some results and see how the patients do. And then we're going to report those results along with any complications. So far, we've had 0. This is the worst part right here. This is the big annular tear. It's at the top of just the most outermost part of this herniation. And the outside of the annulus, the outer annulus, is what has the most painful fibers. The inner annulus has far less pain fibers. If I could just get that little guy loose. I'm going to try to grab him out. We're just at the outside of the disc. We don't have much more to do. There you go. Nice. That was a nice herniation that came out. Just about done. 2 minutes, or 1 minute, I should say. Oh man, look at that. Another one came out. She okay? Okay. I'm just wrapping up. Yeah, she doesn't like it.
We have a follow-up question from Clarence.
Uh-huh.
When you go through the disc from the front and remove the herniation, does the laser release the disc or it just remain?
When I go through the front and like on the cervical, and I didn't get the rest of that question.
So when you go from the front to remove the herniation, does the laser reveals the disc or it just remains? Or it just reseals?
No, the disc reseals. Yeah, the disc will reseal. The laser does not reseal. The laser cleans everything so that the disc can reseal. If you don't clean it, the disc won't reseal. As a matter of fact, because before we do the laser, the disc is trying to reseal. That's why it hurts so much, because it's not able to. Wow, I feel really good. We're pretty much done here. I'm just picking away at the last crumbs, and you can see the disc space there. You can see the tear at 12 o'clock. I'm just zapping it with all I've got. The spinal cord is going to be just at 12 o'clock past the tube. It's pretty cool. Let's see if we can even see it. It's going to be just there at 12. That's the edge of the dura. We're just underneath it. Another little guy's coming out there. Get this last piece here, and we're done. All right. Good job, everyone. Great job. Beautiful surgery. Let me tell you something, folks. When I learned how to treat these thoracic disc herniations, I trained at the very best neurosurgery training institute in the world, University of Florida, Gainesville, one of the top 3 in the world. And the way we handled these things, we would actually make a giant cut from here to here, literally this long. And we would peel all the muscle off the spine and pull it down to about here. And then we would drill all the bones off and go around. It's called a transpedicular approach. And the patients, you know, some of them could even die from that kind of surgery. And they would certainly be in the ICU for a long time, at least a week or two. Touch and go. Major surgery, screws and rods, dropping the lung, removing ribs. I mean, massive, massive pain and suffering from the surgery. And here we are now with the Deuk laser disc repair developed right here at Deuk Spine Institute by myself. Minimally invasive surgery. And all the doctors turn patients like this away. They don't want to do surgery because all they know is the major surgery. But this endoscopic surgery is quite amazing. You just have to know what you're doing and do it carefully and pay attention to the patient's anatomy. You got to know what you're doing, and this is just going to change medicine. So our biggest risk is a pneumothorax, you know, drop in the lung. And so you got to just stay away from the lung fields. You got to be very careful. She's doing good, oxygenating well, ventilating well. So now the nice thing is we have her awake while we're going in. So if we do get into an issue with the pleura around the lung, she's going to say, ouch, I felt it in my lung, literally in her chest wall. So we didn't have any of that. I pay attention as I'm going in. And I'm very happy with this. I think she's going to be happy with the results. There's the whole incision, guys. 4 millimeters. We've taken a surgery that's extremely bloody and very dangerous, that involves removing ribs, removing bone from the spine, going around the side to get to the herniation. And even then, it's not a good option. screws and rods along with it. And being in the hospital for weeks in the ICU on life support basically, we've changed that to a 4mm incision. This surgery was first done right here at Deuk Spine Institute for the thoracic spine. And I guess patient number 15. All right, any questions?
No, sir.
Okay, thank you for watching. Let's run one more thoracic Deuk laser disc repair testimonial, and we'll close down for the day. Thanks for watching. Don't forget the Deuk Spine Institute app on your phone. You can download it and use it. A lot of good information there. Thank you. Good morning, I'm Dr. Deuk Machen, and I'm here with one of my lovely patients who had the courage to undergo a 3-level Deuk laser disc repair for 3 herniated discs in his thoracic spine, T10-11, 11-12, and T12-L1. And how long have you known about these herniated discs in your thoracic spine?
Since right after my accident, which is March 3rd, 2019. It's about a year and a half, a little less than a year and a half.
Mm-hmm. How are they diagnosed?
With MRIs,
Yeah.
as herniated discs, and treated with shots, cortisone epidurals,
Yeah.
and recommended fusion surgery.
Well, and you tried also, didn't you try stem cells or PRP at some
I
point?
tried stem cells
That
as well.
didn't work?
No, sir.
And we tried your facet joints first because we thought, well, maybe it's the facet joints that are causing
right.
the pain. And that helped a little bit, but didn't really fix the problem.
I'm not even sure that it helped. The only thing that really helped was the surgery.
All right, what surgery did you have?
If we're talking about in all my surgeries, I had 2 neck surgeries with 4 herniations, laser surgery.
Deuk laser disc
Yes,
repair?
and lumbar 3 herniated discs, same laser surgery.
And did those work for you?
Yes,
All right. But you hadn't had the thoracic disc treated until yesterday.
until less than 24 hours ago. Yes.
And why did we finally decide to do the Deuk laser disc repair, endoscopic repair of those 3 herniated discs in your thoracic spine? Why did we decide to do that yesterday?
It was my only hope. Otherwise, I think I was looking at fusion, and you were willing to take a chance on me.
Yeah.
And it worked. And I noticed as soon as I woke up the difference.
Okay. So what kind of difference did you notice after your Deuk laser disc repair in your thoracic?
The deep pain that was inside my middle back, that was about that much, 6 inches worth of pain, nonstop for a year and a half, like somebody had a knife in my back, was gone.
Amazing. And you have some soreness from the surgery, but it's different now.
Yes.
So would you say your pain in your thoracic is cured?
Well on its way, yes. I would say yes.
Good. And are you taking any painkillers for the surgery, or
Yes.
what are you taking?
I'm taking Oxycontin and oxycodone.
But you were taking those before your surgery?
Yes.
Yeah. So, but you're not taking anything new because of the surgery I did, right?
No.
Power. So basically it's done, it's a small incision, 4mm, we did 3 of them. And we're gonna get you off your painkillers. That's one thing I'm looking forward to,
looking
now
for
that we
that.
fixed the thoracic pain.
I'm looking forward to that too, as well.
And you're walking in here today, one day after surgery.
Yes.
You didn't go to the hospital, you
No.
had it outpatient. Anything you want to say to the rest of the world about your thoracic disc surgery?
Just thank you very much. You saved my life.
Oh, you're welcome. My pleasure. That's why we're here.
Thank you.